Board, since we do have the health department here, I would prefer to remain seated here, given the presentation, so that at any time, if you would like to speak with Dr. Bensi or one of her staff, they can then walk to the podium. So that way we're all keeping our distance. And Dr. Bensi, I appreciate you and your staff taking the time to be here. This is a very important topic, as you can imagine. And I really do appreciate their support in us trying to come up with what we feel is a safe model and also comply with the expectations of the state, as well as all the concern and feedback we've received from teachers, from parents, from community. It's not an easy decision because we all know we're in a pandemic. But also in the midst of that, we know the importance of education and making sure that our students have the best education possible with all those circumstances taken into consideration. So I do know this. I believe I stated this before in the last presentation, that it really does not matter what our overall plan is. It's not going to be ideal for 100% of the population. I think it's our goal to come up with the best plan that can meet the needs of the majority of people, but I do believe we have to have the safety considerations of all employees and all staff and all students at the back of our mind when we're making sure that we're educating our students in the midst. So a couple of things have happened since we were here a couple of weeks ago. So I would like to begin with the beginning document. The next slide, please. And as you know, at the beginning of the week, we had an executive order from Commissioner Corcoran that stipulated a few items that all of us needed to think about with our reopening plan. So I'll wait till Ms. Boyce gets each of these handed out because sometimes it's easier to follow with paper. And if you don't mind, if you'll give Dr. Bensi, okay, Dr. Bensi one so she can kind of see as well. But probably the biggest item on here that needed to be put in the minds of all, and our original plan had many of these elements already in there, but there was an adjustment where it did state that we needed to ensure that all of our schools are open and available for parents that choose to come 5 days a week. And we made sure that we kept that in the back of our mind when we were making some adjustments. But not only have we heard that language from the commissioner, each and every one of us have had emails from parents requesting the same thing. So this is not new. The reason that we all know that we had kind of a hybrid approach in some of our cases was to also look at that social distancing, and I will get into those options a little bit further. But I wanted to bring that order to everyone's attention because we want to make sure that everyone listening is aware, if they have not already heard, of that change. So in summary, next slide, that is the expectation, is that we give all families and students those opportunities. The commission and the Department of Education would like to see every school's plan submitted by July 31st. That also includes all charter schools and private schools. So everyone that are bringing students back, they want to see and approve their plan. But he also lists in there that there will be some flexibility. And that is really critical in our plan, because we do know that at any given time, we may have to close a school throughout the school year, and we will have to change with some flexibility of our instruction. So that caveat right there allows us that if those situations happen, our online and other methods of instruction can count in the 180-day requirement of student instruction. So those are key elements within the order. Next slide, please. In the plan, we do, they do want to see some percentages of certain things. They want to make sure that they're aware of how many students and families are electing to come back in a full-time basis. And they're also going to make sure that they work with us and hold us harmless when we have an approved plan, in terms of if they do know how we calculate FTE. It could be that one of our schools or a couple of our schools could be closed down for COVID cleaning. Students may be at home doing their instruction, and they're going to make sure that those students are captured in daily school attendance so that our FTE numbers aren't skewed, which also has an impact on our funding. So that's what number 5 really is giving districts information on. So those are just some key elements. The order is much longer than that, but those are the things that the district needed to come up with in a plan to present to the board. Like, we're putting all the elements that have been brought forth to us. This is one. We had a survey, I want to remind the board, where we had over 20,000 parents respond in terms of their choices. And 54% of those said they wanted their kids going back every day to school. That's important for us to know. Every day they wanted their kids going back. But with that, we had many that did not want every day, that wanted either a hybrid or they wanted an online full-time component because they really weren't comfortable yet. So we needed to be mindful of that. We also heard from employees. They're concerned with their safety. We've got to make sure that no matter what the plan is, we're putting those safeguards in place for all of our employees. We don't want to put anyone at risk in these situations. We've not had all of our students back collectively in a building until August. I will tell you, we started our Camp Care with our Title I elementary schools yesterday, and we had 300 students that attended a collection of 15 schools. So we didn't have a lot of students back, but I will tell you, they were thrilled to be there. They came prepared to learn. They had masks on. We checked temperatures. And the teachers were also really excited to see them back. So it really warmed the hearts of many to kind of get back into the routine of coming to school. And I think that's what parents really are saying too. We do know that it's been a hardship for many not having the schools open with their employment status. So there's just so many things to consider. Now just about as many that need us to be open completely. We have just as many saying, I'm not sure that we're ready for that. So it's a very, very difficult decision that the board is faced with. And I know that you will not take it lightly, just like I don't take it lightly on the presentation of my recommendations that I'm giving to you. We have to take all these factors into account.
Before you move on, Reverend Golden?
No, I'm at the page of zip codes.
That's where I'm going right now. So if we'll move to the slide with a zip code.
And I guess the question that I would like to know is whether or not the surveys that were taken gave you any demographic information with respect to these zip codes, where the highest COVID-19 infections are. I'm appreciative of the fact that we got such a tremendous response, but I would also like to know whether the responses came from the areas that have been identified as hotspots in Manatee County: 08, 221, 203, 207, 205. Do we have that information?
I can answer that question. So for the group looking at the slide, Dr. Bensi provided this yesterday, and it's very valuable information because not only is it valuable for Manatee County, It's information on the state of Florida's health center. These are the hottest, some of the most impactful COVID cases in the state of Florida, not just Manatee, in these 5 zip codes. So these are hot spots right now. So Reverend Golden, in terms of the overall, out of the 20,000 responses we had, we didn't break it. We gave them an opportunity to break it out by school, so we do have the information by school, which is tied to the zip code. So we do have that on the collective number, but we've also asked each school to contact every parent. Because with that, even though I say I have responses from every zip code, the numbers in some of these schools may have fewer parents responding than in other zip codes. So we wanted to make sure that every family is contacted so that we can get their perspective. I will tell you now that we've had some slight changes. Next week, we will need to go back and re-examine what parents' requests are. I will be sending all this information out this evening. Mr. Barber and his team, as well as translators, are ready once we kind of have a collective idea today. So this will go out to all of our parents, all of our employees, so that they can reevaluate. They may have chosen or said they wanted something a month ago, and today their answer may be very different than it was even 2 weeks ago.
And the issue for me is that the report or the request that is made of the state in terms of what we want to implement here include within it a consideration of the fact that we have these zip codes where there's a disproportionate representation of poor, low-income, minority people. And I'm wanting to make absolutely sure that what we send is not going to be different than what the health department is able to recommend as would be healthy in Manatee County. That to me is the line in the sand.
Well, one of the main factors in the order, if you go back in and read, it says that we are required to work with our local health department. And at their recommendation and advice is kind of how we're supposed to take our lead. So we're fortunate that we've had such a great relationship since this whole situation has started. We hear communication from their department every day. They keep us well informed on information and data as well as our cases. And later in our slide, you will see the information that has been gathered and the impact of COVID that has in just a couple of months affected some of our own employees and so forth. But that is a requirement with the plan, is that we are supposed to be working with our health department on making the best decision, because each of the 67 counties are very different and their needs are very different. But that's a very good point.
I agree.
But
I just want to make sure that we are not contributing to the anecdotal information that comes out that African Americans, brown, and poor people are disproportionately impacted by this virus. I want to make sure that that's not happening in Manatee County. That's all.
Thank you. So if you look at
Before you move on, Mr. Minor's also signed up to speak. Mr. Minor?
Thank you, Madam Chair. Page 2 of the order that I'm looking at, the emergency order 2020-E006. On page 2, down by the bottom, it says reopening requirements. A, all schools open. Upon reopening in August, all school boards and charter school boards, governing boards, must open brick and mortar schools at least 5 days per week for all students, subject to the advice and orders of the Florida Department of Health, local departments of health, Executive Order 2149, and subsequent executive orders. Now, I may have misheard, but it seems like earlier comments suggested that, well, we don't necessarily have to have our schools open 5 days per week, for all students. Did I mishear?
The order requires us to give every parent the opportunity to attend school 5 days a week unless we have to close it for any type of COVID exposure, cleaning, etc. It does not mean that every child is required to attend 5 days a week, but we are required to give them an opportunity to attend.
Yeah, I followed up. I did not find in here the sort of caveat just expressed, and I've written down in my notes in examining this, about, if we find that there's a student or a staff member in a school who tests positive, and we have to close down the school, for cleaning and whatever. I did not find that language in the order that I received. Now, that may be, I just read too fast.
No, sir, but the intent of the language that talks about flexibility
Where
in your plan,
where is that?
that's in the very beginning, on the first, it's on page 2 of the handout that I gave you. I just took out the highlights of it.
Well, I'm looking at the order itself.
Right. I took out aspects of the order so that I could just really highlight the elements that we had to put in ours. And if you go to even to the third slide, it's our remaining opening plans. It says it gives you the flexibility and continuity in this order for that very need. So that's what that intent is. I'm very fortunate. I went through that order. I'm not of legal mind, and I went through the order with the FAD's attorney out of Tallahassee, so I could fully understand the intent of those different aspects. But they do know that health and safety and working with the health department is critical, and that is one of the CDC requirements and recommendations when we have a case that we've practiced and put in place from the very, very beginning. So that has to be spelled out in our plan. And so that's what that element means. We will have to have those interruptions if we have situations that do occur.
Well, I agree. I think it's, what the superintendent has for a plan makes more sense than the order.
The order's kind of complicated a little bit.
The order just says that they have to be open 5 days a week. Now, it's suggesting that at the local level, there is more understanding of the needs of a school and protecting students than is reflected in this order. This order, the explicit in there is, has to be open 5 days a week, which I believe is not wise, and the suggested plan, if I understand it, that the superintendent is recommending, it makes more sense. For anyone in Tallahassee or Washington to say, you have to be open 5 days a week, is not sensitive to the need to clean, the sensitive to the students, and I understand from earlier comments that FAD's attorney, which is not the attorney for the people who sent this order, says, put it in your plan and it ought to be approved. Well, I would hope so. But the idea when they send out an order, you gotta be open 5 days a week, and everybody gotta go to there 5 days a week regardless, without the exceptions, is, like turning our schools into death camps.
Well, the fortunate thing is we are able to, work directly with them. It does give you the language in the plan, in the order for us to submit a plan. I also had been on 3 conference calls with DOE in the last 3 days. So I do feel comfortable with what we're going to present today as definitely a plan that will be approved, and we will satisfy the requirements of the order, but also satisfy the request and feedback from our staff, from our teachers, as well as from parents. Remember, we've worked hand in hand. Mr. Wagner works directly with the ASME union group. I'm working directly with Pat Barber in the MEA, and we have to take a lot of considerations into play here. We certainly want to be mindful of getting students back in the building, but we also need to be mindful of employees' health risk. So I think we're all working very hard, each district, to come up with the best, safest plan. And like Reverend Golden stated, we do have a number of attendance zones. I believe the last time we met there were 2, now there's 5. So it is growing. It is a cause for concern, which is why our plan is not going to just say, Mr. Minor, every child has to be in the building 5 days a week. So I do think we have enough data and support behind giving us flexibility to have some varied options, because options are needed. And I do think it satisfies the order. So if we go to the next page, which is page 6, which is also a very important page. If you look at the percent of cases, of positive cases for students, I know that for many and for quite some time, you would hear that it really is a virus that is not having an impact on children. It's predominantly older folks. I'm not sure if it's because our children have been quarantined. Think about it. They've not been in schools. They've been separated out for quite some time. But where once upon a time the average age that was impacted when it first came about was 65. Then it dropped to 55. Well, I believe right now in this county it's around 35, especially if you take the long-term care population out of the equation. So it is dropping to an overall younger rate because younger people are mixing together in crowds, which can end up causing some of the infection. So we can't really say that it does not affect children. Now, has it affect children in the same percentage, same rate as adults? No. But it is a new virus. And really, until we have schools open, I don't really know that we have all the facts yet that we're going to see. But if you look at the very beginning and the bottom charts, and you from June 12th all the way through now, and you compare our data and the number of cases compared to the state, each one of these calculations, we have exceeded the percent of infected cases per tested children than the state has. So the last test were, when you looked, we're at a 35.7% positive rate compared to 24.2% of those tested being positive for the state versus Manatee County. So our percentage is pretty substantial. And if you look, I didn't give you all the counties in the state of Florida, but we're among the highest. We're in those highest groups. There's a couple in the 40s or near 40, but we've got to be in the top 10, top 5 impacting children. I will tell you, yesterday was summer school. We had a person calling the children at Rogers Garden that didn't attend, just to remind parents, etc. and the parent said, my child did not come today because they have COVID. But not only do they have COVID, everyone in their house has COVID. So children can be affected. So we really need to be mindful of that.
Before you move to the next slide, Reverend Golden?
No, I'm sorry. That's fine.
Okay, Vice Chair Kennedy?
Yeah, no, when Mr. Minor was talking about the emergency order from Corcoran, I had a few comments to make, but I think it'd probably just be better to finish the presentation and then we can kind of come back.
That's wonderful.
So I'll save it.
I would prefer that. I
Yeah.
just want to make sure that if there's a board member that wants to speak, they have the opportunity.
You can
That
cross
was
me
what
off.
I was going to say.
Okay, proceed.
Thank you. Okay, let's go to page 7. If you will look at this page, I think it's pretty daunting myself. Since the middle of March, we have had 43 sites that have had employees impacted by COVID, and that has equated to over 350 staff members. They either are positive, have had to be quarantined because they've been directly associated by someone that was positive, so we had to isolate them. So it was either an indirect situation that we separated them to prevent the spread, or they were directly positive.
And this is when schools are empty in the summer.
This is when we've had minimal employees or populated buildings. And a number of these have had to be closed for cleaning, etc. Some might not have had to be closed because if it happened where we found out on a Friday, we closed it on the weekend and it was back open. So not all of them had an interruption of work, but we've had employees that have worked at every one of these sites that if it were a school day or school in session, I just think it's important for everyone to be mindful of that. And I think it's important for parents to be mindful of that. Next slide, please. I know this is going to be a very hot topic of discussion, and I can respect that. We're going to talk about face coverings and CDC and Department of Health guidelines. And I can tell you, I've had just as many differing opinions on this subject as I have on should we open schools or not open schools. But our recommendation is that definitely if students or employees or anyone cannot socially distance, it is expected for them to have a face covering. I will tell you that many of our schools have purchased the shields, plastic shield coverings for children, as well as the desk, as well as the teacher, because it is very important, especially in the learning years, formative years, that they can clearly hear and see the pronunciation of words, the movement of the mouth. Some people find it more comfortable to have a shield on than a face mask. So it is our recommendation, my recommendation, that if they cannot socially distance, they are expected to have those on. But I also want to make sure, because I have had a number of parents contact me that their child may have a medical issue or a person may have a medical concern with that. We will definitely look into any child, any employee that could have a medical issue and address these on an individual basis, because I don't want parents to think that that will not be a consideration. We are providing funding for all the schools to purchase at least 2 masks, cloth masks for children, and items for employees. And of course, we're expecting everyone to follow proper protocol and dress code. We do know that preventing the spread, and I guess now we're hearing that it really is an airborne situation virus, it's going to be vital to us keeping our buildings safe, our employees safe, our students safe. With all of these precautions, the expectation is if you don't feel good, don't come to school, don't come to work. You should stay home. We certainly don't want you mingling with other people if you're possibly infected. But sometimes people aren't aware that they're infected. So it does give an element of protection. I do believe that. I know the board may want Dr. Bency to speak on her belief of face coverings at some times because it's a hot topic. We've received a report from the pediatric study that came out after the last workshop. I'm not a medical expert. I do not know, but it is the recommendation of the CDC and it is in our plan, and I understand it's controversial.
I thought we were going to wait. Reverend Golden, you signed up.
Thank you, Madam Chair. And you are absolutely right. Dr. Bency, I would like to know if any of the recommendations that you have heard from our superintendent who sourced this from the University of Kansas Health System, if she has omitted anything that we need to add. Yes,
But you'll need to go up to the podium.
yes.
On the face coverings.
Yes, and I'll, to be quite honest with you, I'm gonna do this for the secondary and for the transportation, the temperature checks, because those are the 4 issues that are directed to the health department to help us to determine.
And instead of me having to interrupt, I'll just say it's the same guideline for secondary and transportation, so I don't even have to go through that. So the face covering is the expectation without social distancing.
Yes, ma'am.
Great. So good afternoon, school board chair, members, superintendent, other leaders from the district. Thank you for having us. The goal here is for us to work together to have a plan that everyone supports. But what I would like to really emphasize, something Dr. Hope said to us the first week, back in the end of February, when we were the first ones in the state to have a case of COVID in Florida over 4 months ago. This is a community issue. The school system represents the community represents the school system. So we should be working together and make sure that what we're doing here is the same as what we're doing out in the community and at home. So just want to make sure that everyone understands that it is a community-wide effort to make this virus go away in our community. And obviously, until we have a vaccine, that's not going to happen easily. And together, working with these types of mitigation strategies, we will be able to reduce the spread of the virus. Masks, as is displayed in this wonderful graphic, explains the risks as different scenarios are given here as examples. So obviously masks can help, and they certainly can't hurt. I know there have been rumors about carbon dioxide. Remind you, please, that surgeons wear masks all day long for years and years, and they wouldn't be able to do their profession as well as they do if they were having brain dysfunction because of carbon dioxide present. So please understand that is not the case. Masks are very important. The ones that you're talking about in terms of cloth, they can be washed up to 15 times, very easy to maintain. We will work with you as we have already in the community. We've distributed over 300,000 of them in the community, and we're wanting more. So masks are a mitigation strategy that are very useful and very easy and can dramatically reduce the spread of infection in our community.
Dr. Bency, you've heard reference the Association of Pediatric Physicians report. I read it. Now, what does the sentence in that report mean that says, and I quote, every child over the age of 2 years old should be required to wear a mask? That's a quote from the report.
And I would say it depends on the situation. And my epidemiologist here, Kayla Schmidt, reminded me today, We have seen no cases in daycare centers because of the way that population is being taught. So there's one teacher, the same teacher, they're in the same classroom with the same individuals every day. Obviously, the family is doing the right things at home as well with these children. They're not going out, but they're not wearing masks in the daycare settings. The teachers are, but not the children. So there is some evidence there showing us that depending on the conditions, that these masks may not be needed in small children if they're around one another and they have a low risk of spreading or even having the virus to begin with. Now, if they get it at home, as we're seeing in what you just presented, Superintendent, there are children under the age of 1, under the age of 5, and the cases are higher as you get older, but nevertheless, the COVID is present because they're getting it from their family members at home.
If we weren't gonna spread it to other kids in the school, you wear a mask.
Exactly, especially as we get older and the asymptomatic carriers are evidenced by the testing that we're doing in the community.
All right, thank you.
I guess why Dr. Mency's up here.
Okay,
Dr. Mency?
then you. Sorry.
And you reminded me of it when you talked about the daycare settings and the teachers wearing masks. And as we discussed early on when we all met, one of my greatest concerns is our staff and specifically our educators in the classroom. So based on the testing of basically the pediatric population, teacher's not going to know who in the class is an asymptomatic carrier. And it is of little value to have children in the classroom if we don't have an educator in the classroom. And we've seen a number of cases among our staff when we have limited to no children in the building. So one of the areas that I'm most concerned about is and let's assume that it's airborne, and let's assume it needs tuberculosis type precautions. How best can we ensure that our classroom educators are protected to the fullest extent possible? Because to me, that's one of the major issues that we have to address. I think we know how to mitigate it with the children, but we have one employee that I think was on a ventilator for, for an extended period of time, and a relatively young person. And the sure way to wipe out the school system for the quarter of the year is for 25% of our educators to come down with us. And so what would be the recommendations with regard to mask, types of masks? And I brought a whole collection because the public doesn't fully understand the difference between an N95, a KN95, a 3-ply surgical mask, or a 5-ply surgical mask that looks that way but is an N95 or N99 rated mask. And our teachers are scared. I mean, I think we've gotten the emails from them. They are really, now the epidemic in our area is to the point where almost everyone knows somebody who has had not just the infection, the disease. And so we need to be able to make the recommendations, but through your assistance, to give our staff some level of comfort that there is a safe way. We know, 30 years ago, you go into a patient's room and you follow all the precautions and somehow you manage to not get infected. I mean, there's a process there, and I think with this, it's predictable and it's definable. But one of my greatest concerns is we need to give our staff, especially our educators in the classroom, a level of comfort that these are the mitigating types of behaviors and products to use that work. Not everything's 100%. But it can minimize that risk of the infection.
Absolutely, and I would ask you to utilize the tool, the checklist that's available. The CDC is looking at revising guidance
Right.
already, and that's something that we've all learned from this
Yeah, the airborne
virus. As I said, it's only been with us, less than 6 months that we know of for sure, and therefore, things are changing every single day. So flexibility is the key, but I think the masks are a major component. However, again, looking at who's in the room, where are they eating, are they interacting in the hallways or not? I mean, all of those barriers will add to that next level of safety. So you see it in, at the hair salons. Some people are wearing the visor with the mask. There are a lot of options out there. The cloth masks, as we said, you can, they're not as expensive, and you can wash them over and over again. So we can help you with that. We have a team to assist you. The bottom line is, how many barriers can you put in place to make sure that your teachers and your students are safe?
Yeah, and a follow-up, is there value if we can cohort students into a unit and keep them where, and let's take the high schools, the elementary schools, we're going to be able to do that anyways because they don't move around. But in the middle schools and the high schools, if we can create cohorts within the school and the faculty move from room to room, as opposed to all of these adolescents moving from room to room, and eating in the room, so we have a number of cohorts throughout the building, as opposed to a mass population that's moving and interacting. If we were to get a positive case within the cohort, would that have less of an impact on the entire school population in that situation, rather than us having students move from room to room throughout the day and eating in larger groups?
Absolutely.
Would that be easier for you to help manage the?
Absolutely.
Okay, thank you.
Vice Chair Kennedy.
Thanks. I just wanted to bring up, since the American Academy of Pediatrics came up, I want to just share this quick piece, because to me, and I think all of us, we've just been kind of ricocheting back and forth between over the past 4 months as we learn more and things come up. But the Academy of Pediatrics came out about a week ago and said, released a paper, the thesis of which was that the damage of being out of school was worse than the potential damage of the coronavirus and contracting COVID. So yesterday, the group of parents and advocates that say, get my kids back to school, everything's fine, that article started to be circulated, and I did find it was interesting because one of their recommendations, most of them adhere to CDC and Department of Health guidelines, but one of their bullet points said that if students are wearing masks, only 3 feet of social distancing would be required. So I was like, oh, that could be a game changer for our plan, because we could get more kids in. And sorry, I gotta fix my mask. Don't keep track, Gina. But then yesterday on NPR, I don't know what her title is, but let me just read the quote. The way the numbers are looking in Florida right now are concerning. The level of the virus is high, and so a statewide mandate to reopen schools without consideration of community spread really goes against our recommendations. So even the American Academy of Pediatrics, over the course of 4 days, specific to Florida, says, forget what we said 4 days ago. Based on conditions on the ground in Florida, this is really a bad idea. And I'll just cut to the chase. I think we would be crazy to reopen schools right now. The superintendent is a lot more diplomatic than I am, and I know she will submit a plan to the DOE, even though this emergency order is probably illegal and can't get away with it anyway. But I'm cutting to the end. But I just want to be really clear. And I've talked to the superintendent about this earlier. I think we've got to find a way to possibly postpone the school year. We've got some wiggle room in June that if we push the whole calendar back, and just let's regroup in a couple of weeks and see where we are, and then let's regroup 2 weeks after that and see where we are and come up with a plan, because I just think the idea of opening school, especially we've had 350 employees infected and the schools are not even open. Kids aren't even there. So what are we going to do even if we bring 50% back? What is this going to look like? So you guys know how I feel about masks. And as long as, Dr. Bensi, we were on it, I've been at Manatee the past 2 mornings for summer camp, and there's pre-K kids jumping out of cars. There's kindergarten, first grade, second grade. They all jump out of their car. They got a mask on. They have no problem with it.
I told you so.
Yes, you did.
Capable of doing it.
And it was good to see it with my own eyes.
And they're excited to be in school.
And they're happy to be back, true. But I don't want to put those children or their family members that they go home to at any more risk than they have to be. When all we got to do is flatten the curve again, like we did in April, and then we can reopen schools safely, or at 50% capacity, wherever the case may be. But yeah, those little ones, I saw it with my own eyes. They can do it, and because there's been pushback on masks, I think like everything, public opinion is moving quickly. We have 54% of our parents say, "I want my kid back in school," but that survey was a month ago. So if we ask that question again now, what is that number now? Or if we ask it again in 2 weeks, if numbers keep climbing. So it's just I just want to throw that out there. Just that the fact, and I know we're all aware of this, but like this data and changing conditions, and we're supposed to make a quote unquote vote final decision next week. This is just a discussion today, of course, but it's almost like every day we're going to have to reassess. And but we can talk about some of the details later. So I'll be quiet. Thanks, Jim.
Yeah, I thought we weren't going to ask questions until it was done.
Sorry.
But you
Well,
did
we
bring up a
have
question-
the expert up here.
Well, you did bring up a question that I have, this is my list of questions for today. You did bring up a question that I have. One of the questions that I think we've gotten from parents and teachers is, can we wait until after Labor Day? The way I read the order
I
said,
want Dr. Bensi to sit down. Is this a Dr. Bensi question?
this is not necessarily a Dr. Bensi question at the moment.
That's what I want to talk about too. So responding to him.
But I just want to go back to that question,
Okay.
just because that was one of the questions he asked. And I want to make sure
We'll
that's addressed.
answer that, and then I'll finish my presentation, and then we'll come back to it, because Mr. Kennedy just cut through the presentation and just said, close it down,
That's what I
delay
heard.
it, kick
That's
the
what I heard
curb,
too.
kick the can.
But
That's what I
But I did research the question, because he did come and ask me before the meeting, and we did look into it. Statutory language does state you cannot start before August 10th. Okay? So we know that that's our first date, August 10th. It tells you how many days you have to attend school, or hours, in statutory language. The only way you can delay that is by the approval of the Commissioner of Education. You would have to submit a plan to start later than our date. We have to, once the board approves a calendar, we have to get it approved by the state.
But my understanding of his order is, it says you must open in August.
It did say August.
It says
Y-
August.
You are correct.
I just
It states that month. So could you delay it a couple of weeks in August? Yes, you can. But the order clearly does state August. So for that to be any different, you would have to get an approval by the commissioner and/or the governor. And if the board, and we're just going to talk about this and then finish the presentation, and then we can deliberate. If the board chose to push it back to the end of August, you would have to reapprove a calendar, and then we submit it. And I do believe we would be in line with the order. But before we go there, we just need to talk about all the pluses and minuses of what you're going to gain from 2 weeks, okay? Number one. Number two, remember the ripple effect that will have if employees that generally come back to work and are expecting to come back to work the first week in August, because we have a preschool week of teachers, so remember, you would be backing everything up. Without work, there is no paycheck. Without buses rolling, there is no paycheck. So it's not just that simple. And then you also need to decide, are 2 weeks going to make a difference in the decision? But I think we can finish the presentation. I think there are many points we have to deliberate, and you will see at the very end of the presentation, I do state that this plan that we all could say we agree with, whatever the end result is today, and you vote on next week, could change based on the health department, based on local issues, based on state issues. Just because we all agree to what we're going to do today or next week does not mean it's going to be that way on the 10th or that way for 180 days. As a matter of fact, I would caution that it's going to change multiple times.
And since we're on the slide about masks, and this was a hot topic last time I said I supported following CDC recommendations. That has not changed. I think your plan follows the CDC recommendations. My only request, and I talked to the superintendent about this last night, my only request is when it says medical conditions and IEPs will be addressed individually, my only request is that we have some sort of formal process for that. So like either a waiver or some other kind of document that parents fill out and submit to the school so that it's very clear cut on what they're doing. Because I do think parents need to be involved. I do think parents need to have a say. And I think that that is the best way to make sure that that happens is that piece so they can have like a formal, and I think that's fair to the principals and the schools as well. Like these are the people that have submitted this and that has been reviewed. So that's my only request. And there's something formal there so parents and everybody can be involved in that. And Dr. Hopes, we're
Yeah,
not
just-
moving off the slide.
You know, it's
Superintendent.
quick. And members, I caution us to look at delaying implementing a plan for students to come back to school based on this thing changing dramatically in 2 weeks or 4 weeks. SARS, which was far milder than this, went on for 10 to 12 months. And the way this pandemic is behaving around the world, we're going to be dealing with it till the end of the year at least. And so it's not going to change. It's not, our decisions are not going to get any easier. And whether we start before Labor Day or after Labor Day, it probably would not change what we're going to have to do with regards to our employees and in our buildings, unfortunately. So we just need to address it. Thank you.
Reverend Golden.
Thank you, Madam Chair. The seminal issue that we have to deal with in light of the update that has been presented to us is whether or not, when there is a conflict between what the order says or proposes and what the recommendation of the Department of Health is, which prevails. And I want us to be very clear about what we are asking our superintendent to do. This update that she handed out very clearly says, in order to receive the flexibility and continuity provided for in the order, school districts must submit to the department a reopening plan that satisfies the requirement of this order by July 31st. So that's the first thing. And I just want to be very clear that what we are asking her to do is to submit a plan that overcomes all of the questions we may have about the mask and all the questions we may have about brick and mortar and what 5 days is and is not, that the plan that she's going to submit complies with what the Manatee County Department of Health says is in keeping with the CDC guidelines and that is in keeping with their own Department of Health. If we can agree on that, I don't care whether it changes every day. If that's the baseline, it will change with respect to what the Department of Health recognizes is in the best interest of our children, of our employees, and the community. The rest will work itself out. And we can all, hypothecate and come up with all kinds of exceptions and differences in rules. But in the end, either we are going to be hamstrung by the Department of Education's emergency order, or we're going to be freed to follow the dictates of what is healthy. And I vote for whatever is healthy. So whatever you send on the 31st must be blessed by the Department of Health here in Manatee County, as far as I'm concerned. Because anything else you send is going to be something that we think is in the best interest. And I don't want to be put in that position. You know, we're talking about, well, what happens if this kid does that? What happens if the people come without masks? What happens if they don't get paid, and what if they get paid late? If you die, none of that matters. Whether you get paid again, that ain't no issue. And so this truly is life or death, and I'm perfectly content to set my attitudes and perspectives aside and say, whatever is healthy, that's what we ought to do. And everybody knows, until you get a vaccine, it's all speculative. It's all until you get a vaccine of this thing. And so I appreciate all that I've heard so far. You know, school district approved reopening that is designed to provide financial continuity for the 2020 fall semester. None of that matters. If you land up in the hospital on a ventilator for 90 days and still die, and that's happening, this is probably the most hurtful thing we will experience in our lifetimes. And I first off, I want to thank you for coming. You know, particularly on such short notice. I just kind of hoping that the decision I'm being asked today is whether or not we want her to apply for. But, oh, that's not what this is about?
Presentation first.
Can you put page number 11 up there? Thank you. And Reverend Golden, part of the reason that I did want to have a short summer school when the GEARS, which is part of the CARES Act money, the GEARS finance came in and gave us just a few weeks ago, notified us, gave us an opportunity to bring back and close the achievement gap on our most at-risk students. So 15 of our Title I schools, we are having a 3-week camp care to bring them back to help with that. But part of the reason we put that together and took advantage of that opportunity was to give our paper version of what we thought we were going to do with health practices to see how they would be applied, to see if our students would be able to wear a mask, to make sure that we were able to verify temperature checks, and to go about those protocols to see if we're able to have the spacing and the safety needed in a smaller footprint before we bring the schools back on a bigger scale in August. And what I will tell you, and really it's only been 2 days, it has been very positive. Today has more students there than yesterday, but what you do see is an excitement to be with their friends, to come in and learn and have activities. And we do know that that is an element, and I think that was mentioned. And we're sitting here having to balance both. What are the social, emotional, hardships that have been placed on these families and these students with the separation, with having to be remaining at home, not around their peers, interacting with one another, and not learning with a face-to-face teacher versus keeping everybody safe. And it's a terrible position to be put in. I mean, we're all faced with a terrible decision. Which one is the best? And I think we have to let the data drive what we do. And I think we have to come up with a safe plan first and evaluate it. And I think every week we have to keep evaluating what we're doing. Not monthly, not quarterly, I think weekly. And I think there will be a tipping point that we may have to say, you know what, it's all online. pushing it back may not be the answer. Maybe it's, we got to go back to the e-learning. Mr. Kennedy and I spoke about that too. I really would like time, okay? Because I do know part of that difficulty in the fourth quarter, especially with some of our elementary kids and our students of poverty, they didn't know how to navigate through the system of the computer program and the elements. So I would like time to train the children, to train the parents, to make sure that everybody has their own device, to make sure everybody has proper internet. And there's no way I can get that formulated till I bring them back and assess everything. And remember, many are going to choose full-time online anyway. So how many are going to be in a class every day? So, but I do understand, if we get to a point where there's an even larger outbreak, Dr. Bensi may call me up and say, Superintendent Saunders, I don't think that it's safe right now for you to move forward with your plan. And believe me, she'll tell me that. And then I will have to contact you, and we're going to have a meeting and make some decisions. But based on all the elements today, this is what we think based on today we should do. But that doesn't mean sometime between now and August 10th, it may look different. It may look different. So we will be checking all employees, temperature checks. We are doing random checks with students. Why are we not doing every child right now? I know you're not going to believe this. A lot of this equipment is made in China, and it's not all arrived yet. Mr. Wagner's done a great job, and Ruth Garrett in our purchasing department to get things ordered, to distribute the money, but many things are backed up. So we are going to be checking, but we can only check what you're able to do. So I just want to make everybody aware we will do the very best we can. I don't want to say that every person, because if they can't do every person, they can't do it. I discussed this in length with Dr. Bensi, and we talked about it in terms of our graduation that's occurring at the end of the month as well. Having people stand outside in the elements for a long time before you check the temperature does you no good of getting an accurate read of temperature. So you have to sit there and say, why are you doing this? It's not giving you an accurate picture. So that's where we are on that aspect right now. Okay, let's talk about slide 12. And I've kind of mentioned this a little bit already, but it is important. In these, we are following the CDC guidelines as well as the recommendation and speaking with Dr. Bensi and her department on what we will do. But if we do have a positive case, there could be a portion of a building, could be a classroom, could be closed for 2 to 5 days for us to disinfect. Depending on the situation and the person, it could be a building. We've had that happen here. It just depends on the complete situation. It also depends on what the outbreak looks like. Is it just a person in one classroom? Or do we have 4 or 5 people in different classrooms that are positive, that have been in the building? It could be that we have to close it down for 14 days to let the virus run a cycle so we don't bring those people back to spread the virus even further. So I really do want to caution parents, even if we do open up brick and mortar 5 days a week, August 10th, there could be intermittent times in the school year where their class or school is closed. Maybe a short amount of time, maybe a longer amount of time. We also will have to look at the staff being affected. If we end up having situations where we don't have enough staff to cover, or we don't have enough cleaning crews to go in, it could delay the opening of a building. We do not know. Right now, we've been able to manage it. But until we have 50,000 students in some way, shape, or form back in the mix, we really do not know what it's going to look like because no one's seen it. We have no data here to show that. I don't know that we can use the data from other countries because their cases had declined before those students have been back. So I do not know. So I do want to caution and make sure that everyone does know that if that happens, our continuity learning plan will continue. It will be in our proposal to DOE. Our instructional services will be provided online. So students every day will be provided with instruction and learning. Page 13. These were the plans that we originally began with. I did make a slight adjustment, I believe, to grade 6 based on conversations. Pre-K through 6th grade are our youngest children. They are being recommended to come 5 days a week. Those were the ones that we had the biggest comments from parents that it prohibited them from going to work. It was causing a bigger hardship on them financially than for them to stay home with their children. They really needed us to open up. They also, in addition to having difficulty going to work if schools were closed, they really did not feel comfortable with teaching their children either. They really do value our teachers. They rely on our teachers. They need our teachers to be the ones in front of them, guiding and leading them through instruction. Now remember, that is the recommendation. Parents can always choose to do online. I do not have a hybrid listed for K-6, but we will look at that if any parent wants to go just a couple of times a week and not full-time. Depending on the numbers, we will try to accommodate that as well. But we do know that the ideal situation for our foundational years will be for them to come to school. For 7 through 12, our model is a hybrid. Monday, Tuesday, Thursday, Friday, with Wednesday being a cleaning day. Why? It is because of the sheer numbers and for us to be able to get social distancing. However, please note the highlighted words. Any parent can choose to be full-time e-learning, or they can also choose to come 5 days a week, full-time, per the executive order. But they will need to opt in to either one of those options. The fact that we've had a lot of changes in this county since the survey and those points have been made, our schools are going to have to go back and resurvey their parents, because I will tell you, I've gotten emails stating that they are going to change their position based on all the data. So I do think they're going to have to go back and revisit to make sure that we're fully giving parents the best decision for them today. Now, once they're signed up, can we change? Once school's going, can we change? We will work with them, but we will have to have some milestones of altering plans to accommodate, to make sure that we've got proper number of staff either way, in brick and mortar or outside of brick and mortar, to accommodate. We will work with the MEA on making sure that our teachers also have choice in identifying who could, based on numbers, who could possibly be the full-time e-learning teacher, etc. So we will have a process for that. That has not been determined because it will be completely driven by the numbers of students selecting different areas. But our goal will be to have proper distancing in all the classrooms and or protections in all the classrooms so that our employees feel safe and our students feel safe. Slide number 14. I do think it's very important for me to talk about our e-learning Manatee platform. I know that there are many parents that felt that it was a positive experience, but I also know that there are many that felt that it might not have been ideal. So I do want everyone listening to know that we have heard the feedback. It was done very quickly, but we've taken all the feedback from teachers, from parents, from students, and we've gone back, and our curriculum department is working on making many, many changes. So please note what e-learning Manatee is going to look like. If you are in a hybrid situation, it's not going to be double work for the teacher. Many have experienced Teams meetings or Zoom meetings right now. It will be very similar. If a teacher is teaching to 10 students in front of them and you have 10 that are at home for e-learning, they will be able to see the teacher teaching that lesson live at the same time, streaming at the same time. They will be able to ask questions, get their questions answered, and be a part of the class, even though half of them may be sitting in their living room. We have the technology and the capability set up for that to happen. In addition, we've made in our scheduled time that if a teacher doesn't want to do it that way, we've given them a day in the week where they can record all of their lessons so that, and they can push it through our platform. If you're on the e-learning, there will be live or taped teacher instruction. They will see the lesson taught by the teacher. It's just as if they're in the classroom, so the teaching is going to be occurring. And that was where we heard a little bit of problems in some situations, but I think part of it, many had never used the platform before, and now they're a little more familiar, but we've put a lot of steps in place, protocols in place, and that's what all of our training is going to be before school begins, so that teachers feel better. We're going to show them how to navigate, and we're going to have a set template no matter what school you're at, no matter what grade level you're at, so that parents will see the same format and know how to get through the format no matter what school their child attends. So many of the feedbacks we've heard, we've mitigated that. So our e-learning will not be just assignments being pushed on there. There will be actual daily teacher instruction. So I did feel it was important to put that, a whole slide to that, because I do know that was a concern for a few comments I heard. Page 15. As we've stated, the proposal, elementary, and really it's pre-K through 6th grade, we are recommending that they come back to school full-time 5 days a week. We have staff in elementary, and we have ways with scheduling, with pull-outs and specials and other resource teachers to lower the footprint in the class, as well as we've given schools opportunities to purchase shields and dividers on desks and tables, that they really can be safely separated, where you could have all the elementary students returning as well as sixth grade. So if parents choose that, if that's what they want, if that's what they feel they need, easily done. If they do not feel comfortable at this time with their child coming back to school, they can choose e-learning again, full-time, and they will have a teacher assigned to them from their school giving the same lesson, following the same standards, the same textbook, the same everything. It'll just be done through our e-learning Manatee platform.
Reverend Golden.
Yes, ma'am. Madam Superintendent, how difficult would it be to try to have an image of a demonstration classroom in the elementary school? So that, I'm hearing you talk, but when you say, well, we're going to set it up like this and it's going to look like this, how difficult would it be to have a classroom that is set up like it would be if your child were to go there?
So the board can view it,
No.
for a parent to
Parent,
see?
yes.
It would be very easy to do.
Okay. I'm just suggesting that in order for people to have a clear appreciation of what it takes or what will be taking place, that they have that image. I don't need a picture, but I'm just saying I would, if I were a parent, and I'd like to know what it's going to look like. Then I can more intelligently decide whether I want my child in that environment or not.
We can certainly, we have a K-12 principal meeting next week on Wednesday. We can certainly ask each school to have that set up so that if a parent wanted to see that virtually, they could easily show it so that they would feel comfortable. And that's a good suggestion, because in some cases, parents may want to kind of get a feel of the setting, how the desks are separated out, et cetera. But certainly.
I was just gonna say, I really appreciate that question. I actually went to a school where they had already set up the desk just to kind of see what that looked like.
Absolutely.
But I think parents would benefit from seeing that and understanding, like, these are the things that we're gonna, all the precautions that are gonna be taken, just so that parents make the best informed decision on what's gonna be taking place. I do have a question. You mentioned spacing them out and using the plexiglass dividers, and I know they're not really plexiglass, they're some other kind of plastic or whatever, but
Right,
whatever.
clear, yeah.
Plastic. When those things take place, and I know you said when there's social distancing is possible, masks would not be mandatory. So when those things take place, when the desks are spaced out, when the dividers are up, those types of things, will students be expected to wear a mask in the classrooms?
That will be up to the teacher's need, because in some cases, a teacher may feel that that is necessary for their safety and health, or maybe possibly other children that could be in the room that may have some immune problems. So, yes, they could still possibly have to wear a mask even with all of those precautions in there. But they will definitely have to wear one when social distancing cannot occur. But I'm glad you asked that, because there could be situations. But we're putting all those other barriers in place to try to prevent it. I will also tell you that in elementary predominantly, they have ordered a lot of face shields for the children instead of the masks. First of most, there's not a lot of pediatric masks, and we're having a hard time getting the ones that we have to fit small children as well. So the plastic face shields are really better for them, but yes.
Okay, that's what I wanted to understand, because I think parents have asked that a lot. And to me, CDC says, hey, if you can distance and you can use the proper procedures,
Right.
then you don't need it. But if you can't, like if you're passing in a hallway, if you got to go get lunch, you got to go wherever. Go
Coming in,
walking to art.
riding on the bus,
Yeah.
coming in from the bus lane, et cetera.
Right. I think all those things are completely appropriate, but I wanted to know what the expectation was in a classroom if we can do all these things. And I totally understand that there will be teachers that feel uncomfortable with that. But if a teacher does feel comfortable, because I've heard from a lot of teachers that actually don't want to have all the masks in their classrooms because they don't really want to have to manage that either. There really are two sides to that. If there are teachers that feel as if, hey, I've got these dividers, hey, I've got it divided, everyone's spaced out, and they feel comfortable doing that, that would be fine.
Yes, and remember, we're gonna have hand sanitizers in the classroom. There's gonna be a lot of training, hand washing on a regular basis. That's gonna be a routine expectation. Also note, if they're going outside for recess, and please know that they're gonna have all the same classes. They're gonna have art, they're gonna have music, they're gonna have PE. All the statute requirements are still in place. Recess and PE are still there. And Dr. Bensi can also reinforce this statement. If you're outside running, you are not to have a mask on. Yes?
Yes.
So,
There's a lot of variables being out with, supplies, equipment, touching the sanitizing piece of that. So again, there's no simple answer.
there's no simple answer.
That,
So
she
that
kinda
wouldn't,
brings up a management issue, which is like, as a teacher, I think about the management issue of masks and face shields. Like, I'm thinking about, oh, I'm taking my kids to wherever, and they all take them off. Now I have the management issue of touching all of them, or all of them touching each other, or kids putting on the wrong one. That is the piece that I know as a teacher, there will be classroom management procedures that will be put in place that will help with that. But I can absolutely see the management issue being a big issue for our teachers. And that's actually one of my concerns is how will we manage that? And one of my questions later on, I guess I'll ask it right now, is training. Not just for the students. I agree, we have to train our students, and I've been working with my daughter on that before she enters school. Hey, you know, all the different things. And I've been working with her on all of those types of things anyways. But training for all of the employees so that we really have a clear understanding of what is safe, what is healthy, and what is not, and not given to us by Facebook, but really given to us by facts. And is there some kind of training that we're going to put in place for all employees so that we know, hey, we're okay, this is an okay setting, or hey, no, we are not okay, this is not an okay setting? Is there a training piece that we have planned for all employees that are going to be in our schools?
yes, we are working on the logistics with that. Paul D'Amico and Mr. Wagner, we have most of those things in place as well as a video. We had to do that training before we did summer school for the bus drivers, for the teachers, for the paras, and then of course for the children. I believe, is it posted yet on our website? So we will have a very similar one on our website, but I am also working with some folks that were on our strategic planning group that we do feel it's important to have town hall meetings. They could very well all be virtual, but we feel that it's important to be working with our Hispanic communities and our bilingual communities or Latino communities to make sure they know the protocols and the procedures for when their children come to school and so forth, and what they can do in their home to kind of mitigate that. We're going to be working with some churches, and I have a meeting on that tomorrow to come up with all those procedures, not only on back to school, but just COVID information in general. When I was working earlier today on a Zoom call with the Horns on establishing how we can work with Books for Kids, United Way, and our Dive into Reading for our mentors, because we're not going to have volunteers in the schools like we have before, but how can we still capture the mentors to still help to bridge that gap for literacy for our kindergarten through third grade? So we're working on a plan right now, Dr. Halpin, Dr. Thompson, and myself, so that we can still use all these mentors. And what we've decided is we need to do a lot of training for them as well, because how are they going to deliver the mentoring through Zoom? But we're going to train them, train the parents. We're going to bring them in hopefully to some of the Horns restaurants, some of the churches, so that we can train them on how to get on the platform, how to use the Zoom. And then we're hoping to have MCR Health and other agencies there that really can help us get the word out on keeping them safe at home. Just like we stated, I had a child that didn't come, but everybody in their home, multi-generational, everybody in the home all has COVID. So we've really got to do a better job in explaining and training people, not only our employees, but the people in the community, so that they're not coming in infected. And what can they do to prevent the spread even in their own house? So we do know that's important.
Thank you. Vice Chair Kennedy?
Thanks. I was just, I just would like to put this mask issue to bed. Because the last time we met, we had 3 members who expressed support for a policy or a rule that if you're inside a building or you're inside a school bus, you must wear a mask. And so I thought our mask debate was over. And I think a good reason for it to be mandatory is to make it easier for our employees. It's to make it easier on our students because they don't have to deal with peer pressure. It's a rule that everyone must abide by. So that takes that out of the picture. And as Dr. Bensi just said a half hour ago, it is the best thing that we can do. It's the easiest and best thing that we can do to stop the spread is to have a mask on. I know they're annoying, and we're not going to have perfect implementation, but over time, kids will get used to it, and adults will get used to it. And so I don't know how Reverend Golden and Dr. Hopes feel about it, or Mr. Minor feels about it, but I think no matter what we do, we have to go forward with a mandatory policy for inside buildings and buses. Thank you.
Yes.
You want to proceed?
Absolutely. The last page. Where are we now? What are the next steps? Because these are really what the plan is, and I would just like to capture, all parents will have an option if they feel that it's best for them, for their child to come 5 days a week, no matter the grade. However, we have very clear guidelines and recommendations of pre-K to 6th grade that it is 5 days a week. We do have the hybrid for 7 through 12. Any age group can pick full-time e-learning. Any age group can pick 5 days a week brick and mortar. So we will go back, our principals will go back, they will reevaluate what their parents' desires are, and then we will get to move forward with coming up with the best way to comply with their wishes to the best of our ability, but also make sure that we're keeping safeguards, social distancing in the classrooms, and our numbers at bay. So that is where we are right now. I will need and will be submitting a plan to the Department of Education by July 31st, but it will be before July 31st because after the board votes, there's no reason for me to delay that. And in addition, we will gather the charter schools plans and submit them as well. But I think as soon as possible, it's better for our teachers, our community, our parents, our students, all of our staff to know what the expectation and the plan is today. It could very well change before August 10th, but we all know that. But we do need to formalize a plan as soon as possible so that we're all able to move forward with all the details. These aren't the details. My plan submitted to the state will have details that match what this is. The only lingering thing, and I'm sure you 5 will make it clear before the end, is Charlie's topic. But I really would like, input and some dialogue, because from there we will know I will communicate what is decided today out to the public in Spanish as well as English. We will put it on the board vote for next week, and we will move forward and continue to communicate and change when change is needed.
Reverend Golden?
Thank you, Madam Chair. The report that you have provided us is, and I'd like to be clear too, in the elementary face mask shield page, which is 8, you write face mask or shield coverings will be worn in the classroom, and then you add it at the teacher's discretion. I'm concerned that the only discretion that the teacher would exercise would be the second bullet point for medical conditions and IEPs, which would be addressed individually. And I believe I heard the diplomatic language of the chief health officer for Manatee, but out of an overabundance of caution, I have to agree with my colleague. You will wear a mask from the time you come into the jurisdiction of the Manatee County School Board until the time you leave, unless that teacher in your classroom exempts you because of a medical condition or an IEP. That's where I stand. That's the least, in the words of that great philosopher Forrest Gump. No, that wasn't. That was his TV name. When his real name is Tom Hanks. It's the least you can do is wear a mask. The least you can do is wear your mask, social distance, and wash your hands. That's otherwise. Everything that you've said here, I think the Department of Health has already said that it meets the requirements. So be it. But I would not feel good. I did want to ask one question. Of the 350 people who have been impacted by this, have we had one fatality?
No, sir.
I want to keep it that way. And God forbid that we open up our schools and wind up with somebody's kid not being able to make it through this. It's bad enough that we have all of these ill winds blowing around us as we try to deal with this, than to have to deal with somebody lost a child because of a decision that I made. So to the extent that I can make a decision, wear a mask. When you get on that bus, come on with your mask. And when we get off that bus, you can take your mask off, go home. But the whole while you're in our jurisdiction, you'll wear a mask. Teachers, students, everybody.
Okay, I've heard 2 board members that are in favor of mandatory masks the entire day if they are inside. Am I understanding you correctly?
Yes.
Or on
I'm
the
sorry.
buses.
Right, well, I think we considered that as inside.
Yes.
Dr. Hopes, are you also in favor of that?
Yes, ma'am, I am.
Mr. Minor, what say you? I don't think we've heard from you. I mean, I guess there's a majority of the board, so it doesn't really matter, but
Okay.
Look at him. Look, he's not even 6 feet away from me. He's not wearing a mask.
would you like to elaborate on your opinion on this, or just accept that the will of the board has already decided this for you?
No, I support the wearing of the mask in the schools.
Amen.
I wholeheartedly appreciate the superintendent's plans, and I support the superintendent's plans as a stand. It does not sound as if the rest of the board believes that, so I expect that your updated plans that come before us will reflect the will of the board.
You are correct.
I don't see anyone else lit up, so I have a list of questions. Can I go through them? Okay. A lot of them you've already answered, which is awesome, but I just want to make sure that these questions get put out there because I've gotten a lot of questions from parents and teachers and other people.
Ms. Messenger, before you begin, just so the audience knows, whoever's listening, Mr. Barber is working on a fact sheet right now. So many questions and topics that we've already spoken about will have the question and answer listed. So this evening it will post, and we will continue when we see common themes coming up. We will add to the list, but just note that we are posting those this evening as well.
I really appreciate that. That was one of the things that I asked if you would do, just because I've seen some other school districts do that, and I think that would really benefit, because I think parents and employees have more fear when they don't have all the information. So the more information we can get out, I think the better. So if a parent chooses to do brick and mortar all the way or do e-learning all the way. How easy will it be for them to transition from one to the other? Or if they choose to, if they're in the hybrid and they decide, I'm just going to go all e-learning. This is working out okay for me. How easy will it be for them to transition from one to the other?
I really do appreciate that question, because with our plan, they all follow the same curriculum guides, the same pacing guides, the same roadmap. They all use the same textbooks, same materials, and we've built ours that way so that a parent could transition fluidly from one to the other. We are anticipating some interrupted service with brick and mortar, only because there could very well be some closures due to COVID testing positive. When you look at our data so far, we have to prepare for that. We're going to try to prevent it. We're going to try to keep it at a minimal with making sure that employees and parents know and students know, do not come into the building if you've been around or exposed to someone with COVID. Do not come if you feel ill in any way. Doesn't mean you have COVID, but just think you have COVID. Don't come into the building. So we're going to do a lot of trying prevention measures to prevent people from coming in. However, we needed to build a plan that we could change from face-to-face teacher to online and not skip a beat. And parents may have different comfort levels as well. So the curriculum's the same. The teachers are coming out of their own schools. So if they're teaching online, it's a teacher that would have been hired in the school anyway. They're just choosing to be the full-time online teacher. And as soon as all the students come back and it's back to normal, that teacher will be back in the building every day as well. So all the curriculum, all the standards, all the pacings are all the same. So they'll be right in line with anybody else.
So if a parent wanted their child to switch from one to the other, they would contact the school?
Yes, we will have times where they can change, only so if they're full-time e-learning, we're going to try to dedicate full-time staff to that, so they're not doing both. The hybrid is a different situation, but the full-time teacher, we're trying to devote just certain teachers to that. And as well as if they want to come back in brick and mortar, we also want to make sure that we're not exceeding our numbers with spacing and so forth. So we'll give them times, monthly or what have you, usually at the interim, at the quarter, where they can transfer from one element to the other. Even if you're going into a Florida virtual type thing, there are times of the year and through the season where you can move. So we've got to have kind of those stop measures that you can move from one to the other. But we will work with them. They will work with their school counselor or administrator, and they'll be able to schedule them accordingly. We've worked in focus, and we've already got it set up clearly, identified with a teacher roll book on which one of their students are hybrid, full-time, or brick and mortar.
Okay. Can students take only a few classes and then be done for the day? Like in high school, of course, if they are only a few credits away or whatever, can they just take 3 classes for the day and just have like a shorter day, but maybe come every day? Is that a possibility?
And maybe not come every day?
Or maybe come every day, but take a have a shorter day. Is that a possibility for
We
our
do
students?
have in our student progression plan the types of schedules they're able to receive. Part of it is a scheduling issue. They could be dual enrollment part of the day, so they're there for their academics and they leave. They could choose to do some online with their hybrid. You could easily set up your hybrid schedule that way as well. Instead of the every other day, it could be split middle of the day. So yeah, especially for secondary, it's you could easily do it with a hybrid schedule.
Yeah, I've heard from parents that say, "Oh, my kid only needs 3 classes. Can they just take those 3 classes and go home?"
Yeah, they'll have to work with them on their schedule for the hybrid
A
schedule.
lot of flexibility there.
Right.
How will ESE services be handled through this entire thing? And I'm not talking about self-contained. I'm talking in push in, pull out types of services. How will those be handled?
Absolutely. Well, again, some of the students will be coming every day, and if they need to be pulled out to go to OT, PT, speech, etc., that will still need to continue. If a parent is choosing online, then we certainly will have to work with them in delivering their services that way to, to work with a parent. But also, if they're full-time online, a parent could choose to come in to receive their ESE accommodations as well. It just depends on what the parent preference is. But if they're at home, we will have to ensure that we're delivering all of their array of services.
Okay. And this might be a negotiating issue with the unions, this next one. How will sick leave and perhaps even unpaid leave, if, for instance, a teacher wants to take the year off but not lose her spot, or need additional sick leave because of outbreaks, how will that be handled? And maybe and if you just want to say that's a negotiating issue, that's fine. I just want to make sure, is there any additional
Those
information
are
about
being
that?
discussed. We will have all those aspects identified and worked out. But yes, Ms. Barber will be involved, as well as our benefits and HR department for that.
Okay, a lot of our Title I students really rely on the food that we feed them every single day. So in the hybrid model, how will we ensure that those students are fed on the days that they're not coming to school?
Well, Regina Toma does a tremendous job. Hybrid, we would be fortunate because then we would make sure they're even on campus weekly. But just as we did the last quarter and we do this summer, the students will be fed. There will be different methods that she will work out at different feeding sites to make sure that they are accommodated based on the numbers. But you could do it a couple of ways. They can easily come in on the days that they're not there and pick up their pick up their lunch or breakfast. And in some cases, she could also give them the food for the rest of the week on the last day that they're there. But she will definitely have a detailed plan communicated to the community, to the parents, and to the schools before school begins.
Okay. Let's say a school or a classroom or a building has to close. How is that information going to be communicated to the families?
Well, we unfortunately have had a lot of experience with doing that already this summer. We have a whole process, and it's written and documented, and that's, of course, one of the trainings, so that everyone knows the protocols, as well as the contact tracing that has to go into possible, contact with anybody that has a positive COVID case. But ConnectEd will definitely go out to the parents. It will be conveyed and communicated. The principal of the building or the building manager is directly involved. They contact Paul D'Amico. Paul D'Amico contacts the health department. They all work in concert, and we also keep a list of it in our benefits department. We have all the documents of people that have entered a building, so we know who has entered so that we can contact them. There could be vendors that have been in the building. They need to be identified and know that they need to be aware that there was a possible infected person. So we have a whole written process and procedure that we follow, and it's been pretty efficient up to this point.
Okay, I have a couple more. I see that everyone wants to talk now, but I just have a couple, like two more. Give me two more. One, will employees be tested prior to their return in August?
There is no mandatory testing or ability to enforce or conduct that. Testing is only a voluntary basis, and there are many sites that are conducting testing and providing testing, but we do not require, nor can we, nor will we, or do we at this time.
Okay, and my final one, and you kind of already talked about it, but just for confirmation, there's been a lot of parents that have shared that they are concerned about their child's daily schedule. I think it's mainly elementary students not attending recess or not getting to go to music or art. Can you confirm that all of those activities will still take place?
All of the traditional activities that they've experienced in the past will be in place this next year. Now, the ways in which we go about them may differ. It could be that the music teacher is pushing in to give music instead of them going to a music room. But there will still be outside activity for recess. In many cases, spreading them out and having them outside is probably better than running in a classroom anyway. So yes, we will be providing all the same enrichments and activities they had prior to COVID.
Thank you. All right, sorry, Vice Chair Kennedy,
Okay.
you're up.
I got a few things to cover. I'll go as fast as I can. Number one, this phony emergency order. Does anybody on the board have any willingness to like push back on this with other school boards? And if there's not two other people that are willing to, that's fine. I'll let it go. And I'm curious, do we have, like, how does an unelected political appointee have the power to issue orders telling constitutional officers what to do? So I have some legal questions about the order. Let me say bottom line. Obviously, the superintendent has to submit a plan. I think you should do that. I think the plan you came up with is the best you can do in the environment that we're in. So I salute you for that. This is not, I support this plan, and I salute you and the team for putting it together. But I just don't think the legal basis is here. I think, I've said this many times, I think, and Dr. Hopes, I saw you said the same thing in yesterday's paper. We are the ones in charge here to make our decisions. Now, of course, they can threaten us by saying, well, you're not going to get your money unless you do what I say. But I'm not sure that would hold up to a legal challenge. But I'll just leave that out there. I covered the summary. The zip codes are, two of the zip codes are in Dr. Hopes' area. The other three are in mine. So this is an issue that is most serious in my own district. The numbers are, sure. The numbers are scary statewide. They're scared. Bless you. They're scary in Manatee County, and they're especially scary in districts 2 and 4 in central Palmetto and central Bradenton. A couple reasons why I really think we have to submit the plan, and as we reassess as we go forward, we've had 350 staff members affected, as I interjected earlier, and that's with no kids on campus and a skeleton staff at school campuses. And we have multiple COVID cases and even more who are in quarantine. So if you throw 500 or 600 kids back on an elementary camp, or 250 to 300 back on a campus, I just really fear the explosion of cases we will see, not just in our student body, but as I said earlier, in our staff, our teachers and staff, and then mushrooming out to all the people that they live with. So it's just another reason I think that we should really take a look at putting this off. And I know there's barriers, like paychecks I feel like we could get around somehow. But think about, we are a self-insured entity. So what is a COVID outbreak going to do to our health insurance fund? And I thank Mr. Bergeron, because when I talked to him about this before the meeting, he said, well, we have stop loss insurance, which is great, we do, but then the next time we go to renew, what are our premiums going to look like? And that's money that comes out of teachers' paychecks. So that's just one of the kind of knock-on effects of this. I do have some kind of detail-oriented questions like Gina just had, but I just wanted to stick to big picture for now so I don't hog up all the time. But Dr. Bensey, could you come up, because I do have a question for you from the health department perspective. And I don't know all the details yet, but both Broward County and Palm Beach County boards have already expressed that they're not opening school. Despite this emergency order, they are not opening schools. I have a feeling, I don't know this for a fact yet, but I think their local Department of Health may have provided them that cover because this emergency order even though I think it's fake, it does give you a lot of power that you can be the sole decider whether we pull this off. So,
No pressure.
no, and I don't, that's just a fact. I mean, that's just the way it is.
I told her the opposite. I said, look, whatever you decide needs to be done, that's what we're gonna do, and I'll take the heat.
Yeah.
Because I
Yeah.
can't get fired.
I'll be happy to join you in taking that heat. But it's, so and this is why I want to ask you this question, is there any kind of metrics, whether it's number of cases, percentage of cases, positivity rate, is there anything like that you see now as a target metric that we should have before we open schools?
So as an integrated Department of Health under the Florida Department of Health in the state of Florida, we do not yet have those. We've asked for those. However, I would say, as the superintendent has said, let's look at the data. I commend you all. You have done a tremendous job of developing a well-thought-out plan. However, the community has to be part of this and do their part, play their role, or this is for naught. So if I could briefly just go over what's been happening in our community in the past month in terms of summary. 190 new cases just since yesterday, for a total now of 4,266 cases. Those are individual cases. A person gets, like we describe it, a medical record. So there's 4,200 people, 66 people with COVID that we have identified in our community. The percent positive new cases in the last 2 weeks has been 11.8%. So in the past 7 days, it's gone up to 12.4%. Yesterday, one day alone, the highest recorded in Manatee County, 20.4% positive of those tested. We've tested 49,298 people as of this morning. Those are not repeat tests, those are one person tested. That's almost 12% of our population. So we are more than meeting the governor's request of 2% per month. We've just met the goal for July. We have a lot of sites where we're testing. UTC, Lincoln Park, Home Depot on Cortez. My team at the health department did the convention center drive-throughs. Now they're going to mobile home parks and migrant farm worker sites, trying to reach all populations. And kudos to MCR. They have done 12,000 tests approximately in our county, reaching underserved populations. Their positivity rate has been running at least 12%. Deaths, 138. We saw a lot of deaths early on in the long-term care facilities. Training is imperative. That's what we continue to do, and we have seen the decrease in deaths in long-term care facilities, a lot of training, and those people are healthcare providers. So when it comes to training, mandatory. Absolutely, the infection control piece. I also have Carol Peters here, who oversees our school nurse program, and so working with you on a lot of those details. The median age of all cases today, 39. If you take out the long-term care facilities, 37. Continues to decline, as was already mentioned. We have got to have a campaign in our community, get our children to say, we want to go back to school, but you have to help us, everybody in this community, to make that happen, because the schools will be closed down as soon as they open if this continues in our community. We have the Healthy Teens Coalition, peer-to-peer education. We need to continue educating the community and stop the rumors. There are so many rumors out there, and please, the Q&As are extremely important, getting that messaging out. But society has to change. We have a new normal here, and we do want our children to be healthy and both physically and mentally. And this is a difficult time. We know that for everyone. We want them to be educated in school. That's the ideal location. But we have to do something about what's happening in our community, because our numbers are going in the wrong direction. So it's everyone in our community needs to be involved to make this a successful plan.
Thank you.
Couldn't agree more. So, but Dr. Bensey, so you're waiting for guidance from the state DOH?
We are. And you are the policymakers. I do not have that authority to make policy for the Department of Education in our community, the board, the district. We are here to assist you to make sure that your plan is as solid as possible from a health perspective.
Which you believe it to be.
Absolutely.
Thanks. I have more, but we can come back to me.
Dr. Hopes?
Thank you. Interesting observation a couple times going to the airport in Tampa. When I go over the 41 bridge and I look at that park across from Lincoln, there are a lot of children of all ages all playing together in those water fountains. Nobody's wearing masks. I mean, both times I've gone by that park in Palmetto, there are a ton of kids all over each other, hugging and everything else in the water fountains. And so I don't think that's a really good idea. I don't know who's in charge of that park, but that just brings a whole bunch of people together in very close contact. So that could be one of the few problems up in Palmetto. Superintendent, I have, this came up when we were doing our last quarter of last year. How are we handling families that have multiple students who will be in either the hybrid plan or the online plan with regards to hardware?
Well, fortunately.
Because the student's going to be tied into their classroom in the
Right.
hybrid.
Right.
So if I've got 3 high school kids,
Fortunately, we have purchased a lot of devices. Mr. Hansen's done a great job preparing for the possibility of what may come. So we do believe that every child will be, if they do not have their own device at home, we will be able to provide them with one. Now, I will tell you the issue we will still have is going to be internet service. We will not know until we bring our students back exactly where our shortfall is. Because remember, the last time Spectrum had given quite a few opportunities for a couple of months of free. We also had some hot spots everywhere in the community, and then we had the Wi-Fi buses. Those things will not exist. Now, we've purchased individual hotspots, but we do not know the exact number of need. That's why I really do need to try, hopefully, to have everybody back for a period of time so that I can get the right preparation in place to continue education if we have to go online. So I do feel comfortable about our individual computers. I do think we are going to have some difficulties with internet, but we will have to come up with a plan for that.
okay. The second is kind of in line with Mr. Kennedy's point. I know, Superintendent, you and I had this discussion. Because we are a self-insured health plan, how have we thought through how we are going to determine if it is a work comp case? In a healthcare setting, we have a medical record. We know, that this nurse had contact with this patient and then she ends up with the infection. So how are we going to determine that it's a work comp case for our employee who was possibly infected at work?
Well, part of that I do think goes back to the contact tracing element, and I believe most of the people that we've had information on becoming infected, we've been able to determine that. So up until this point, I feel pretty comfortable about where we are. As things change, it might not be that simple.
Yeah, because
So I
our
think we'll have to
reinsurance-
monitor
our-
that.
Our threshold for the reinsurance is pretty high. So we're exposed to a pretty hefty tab for the early part of the cases. And then Mr. Kennedy asked about testing before teachers return in August. But what is our protocol for employees returning to work after an infection or a COVID-19 illness?
2 negative tests.
2 negative PCR tests?
Or, yes, or 14 days after the last known temperature or semblance of symptoms without taking medication. But if they have 2 negative tests, they can return.
Okay.
The problem we
Over what period
sometimes
of time?
have is sometimes it does take a little bit of time to get the results back
Right.
on the test. That's what we've been finding in some cases.
Okay, because that may be something that we want the public to be aware of, that before an employee comes back to work, this is the protocol to ensure that they're less likely to still be contagious.
And we do have all those written guidelines, and we did pull all those procedures straight from the CDC documents. So if it's helpful for the closure as well as that, maybe we can post those elements as well on our webpage just for reference.
reassurances.
For reassurance for the public.
All right, thank you. And I'd like to thank Dr. Bensey and her team for being here. This is, I don't know how you guys are sleeping at night, but anything we can do to make your job easier, we'll try. We'll try. Thank you.
Start the campaign. It takes 2 weeks to make a difference, so
Yeah.
start it now, see the numbers go down.
Thank you, Madam Chair.
Mr. Minor?
Thank you, Madam Chair. Mr. Kennedy posed the question of the legality of, or pretense that comes down from Tallahassee that they control local education. And Board Member Kennedy is absolutely right. Article 9, Section 4B says the school board, the constitutional officers that are here now, the 5, we controls, supervise the education in Manatee County. The buck stops with us. And I believe we have the authority to say there's not going to be public school in Manatee County, for the next month. And I think that's, what Broward's doing and somebody else,
Palm Beach.
in Palm Beach. And they're saying, this ship is ours. It's our responsibility. The blood is on us, for anybody who, suffers from this. At the same time, we're supposed to be providing public education for all the children here. And that's the rock and the hard place that the 5 constitutional officers that are sitting up here, have to deal with. And, let's say that we did, and I don't think there's consensus here to say, under the circumstances that we really don't know what's going to be going on for the next month, we're going to wait and see. Maybe the school year's not going to start until mid-September or even October. And I believe legally we could do that. It's our call. The superintendent is recommending that we have some kind of response. We don't have to respond to these people. They're supposed to respond to us. I think it's nice for us to respond and say, well, under Article 9, Section 4B, our board has decided to, try to reopen our so-called brick and mortar schools and provide an option to our parents, for their children to attend public schools in Manatee County under these particular circumstances and with these options available. And we just hope and pray that it doesn't get worse. And if it does get worse, I think this board has the option to say, and we should say, the schools are going to be closed, until there's some kind of improvement. And that's a tough call too. But how I see it at this point, the superintendent has put a great deal of thought into, a plan for opening up. I don't think it should be phased or phrased in any way of, well, we're doing it because you ordered us to do. It's just our plan. We're not going to subjugate ourselves to someone who doesn't have any authority. And we're not going to blame them, for the decision. But I think that this board, in authorizing, requesting the superintendent, should make it clear that if this thing, continues at its current climbing pace in our community, it is a gross danger to every employee and every student. And we have to slam the door shut. We just can't go on that way. That's where I'm coming from in my analysis. The portion of superintendent's plan does not, and maybe I missed it, but, talk about what have been integral aspects of public education in Manatee County and every county, and that's, other activities that occur, school activities that occur outside the classroom. Football, any kind of sports. And those are important parts of the education that we normally provide, to our students. I haven't heard any comment or any discussion about that.
Would you like me to talk
Sure,
about that?
would you please?
We began our phase one of bringing our fall athletics back for conditioning, which is using a lot of the CDC guidelines. They're outside, spacing, etc., not sharing the same ball or the same equipment. We were also beginning the same type of phase bring in for our band, marching band students, drama students, etc. All aspects being allowed to be outside. We were about to move into phase two, and I will tell you we've had to suspend that because we have 2 football teams that have football players that have now tested positive for COVID. So we will not move forward with phase 2, which would be bringing students into the building for their conditioning, etc. We have not had any direct word from the Florida High School Athletic Association as to the expectation of games. When you read some of the national coordination of papers giving recommendations on sports, what they say about tackle football is that it is high risk in terms of transmission of possible infection, and it only makes sense if you know anything about football. I don't know how you can socially distance when you're really playing the game, but there are sports that you could, in fact, socially distance and not have a problem. Golf, right? Tennis. So there are some things that aren't as high risk as others. So I think, like all districts, we are trying to tread lightly into doing the things that everyone's looking forward to, everyone's hoping to bring back. And then we have to adjust based on, again, the data and what transpires when we do that. So we were working, we were very positive, but because of that, we've halted, and everybody has to take a step back and just do conditioning outside. When it's safe, when we feel that we're able to move to the next level or the next step, we will, but until that happens, we will not. So right now, we do not have any official stance on actual games being played or contests being held, because really we're waiting on some of that to come from the state level and the Florida High School Athletic Association level. And then when that happens, we'll come back and have a conversation. But I do not have anything other than basic conditioning happening with a lot of social distancing in place. Again, they're not getting it on our campus with our activities. Many things are happening when they leave. They get in their cars, they're together, they're out, you know, in their homes and in the parks. And I think, like was stated, we need to do a really good job on educating and helping our youth be safe so that we can get to those levels.
Madam Chair, may I ask the superintendent a couple questions germane to this?
Please.
Okay. Well, besides football, you know, cheerleading and other sports,
Yes.
I mean,
All those things we've allowed to come back with basic outdoor conditioning. So could be cheerleading, could be football, could be marching band. So those things are allowed, but it's outside with no contact and minimal interaction.
for fall sports.
Yes, sir.
That's the rule.
Yes, sir.
The athletic conference or whatever, giving us, you know, guidance.
Yes, sir.
Now, that's not included in the response.
No, and it won't be.
Okay, we're just kind of, okay, thank you. Well, anyway, conclude my remarks. I think that we endorse the superintendent submitting a plan and saying, and making, you know, reference to our Constitution authority of the board has, you know, requested that the district, through its superintendent, advise the Department of Education of these are the plans based upon the present situation on our community for going forward. And and we watch carefully with our consultations with the Department of Health as to if we continue to go south in a significant way, I think that we ought to have another meeting to say we're going to shut down until we see it significantly better. Madam Chairman, that's how I feel about it. Thank you.
I agree that we should look at it on a regular basis, but I'm afraid if we waited until we had to have a meeting to shut something down, that might not be as immediate as it might be needed, so I'd rather leave the authority with the person that's in charge of operations, which is the superintendent. That doesn't mean that we wouldn't have a conversation about it, but if an emergency meeting takes 24 or 48 hours to notice, that means we're waiting 2 more days.
I don't think it requires.
No.
Yeah, the chair has authority to call an emergency meeting.
That day?
Yes, 5 minutes. You could do it.
Maybe I'm thinking of special meetings.
What I'm
I'm thinking
talking,
of special meetings, okay.
this is a board function. The authority rests with us 5 constitutional officers. And as wonderful and terrific as our superintendent is, it's our call. She can call a meeting, but she can't call for the discontinuance of education in Manatee County, Florida, public schools.
Well, I could say that happened without our approval before, but nevertheless, I have no problem doing that if that happens, that we can call an emergency meeting. Reverend Golden.
Thank you, Madam Chair. I have 2 different topics that I want to discuss. First, Madam Superintendent, in your presentation, paragraph 5 on page 4, it says that the DOE order number 2020 EO06 waives strict compliance with a Florida law requiring schools to operate for at least 180 days. and the law requiring school districts to have a uniform and fixed date for the opening and closing of schools. My question to you is, given what you have presented to us today, are you helped, hurt, or does it make no difference if the plan that you submit to the Department of Education asks that schools be opened sometime after the 11th? I think they're set to open after the 11th of August now. Is that the opening
The
date?
10th.
Yeah,
10th of
okay.
August.
That the plan that you submit on the 31st of July would allow us to open our schools sometime between the 11th of August and, the 11th of September is a Friday, and the 14th of September. Does that mitigate any of the problems that we might have in terms of allowing us as much time as we could use to engage in more thought, more consideration? It's a month, and it's also about 40 or 50 days from the deadline when we have to submit a plan. Or do you just want to say, we're going to open on this date, that's it, and then we come back and meet an emergency session if we have to change that? I'm thinking that, it's nice to have all of these philosophical constitutional discussions, but we've got a school system to run here, and we want to do it as easily as possible. So if we already know how fluid the situation is, can we get consent to open sometime between the 11th of August and the 14th of September, which would be after Labor Day? It would be a Monday, and it would give us another length of time to plan, another length of time to consider. Just something to consider. I know I just sprung that on you, so let me go ahead with my other.
Can I respond a little bit to that, though?
Yes, you're great.
So part of this, and I just gave excerpts, part of it, but the order says August. So the district school has to begin in August unless the commissioner approves otherwise in the plan submitted by July, number one.
That's what
Number
I'm at.
two, when it says open school, they're talking in the traditional sense of opening up brick and mortar. Our school in the plan can be defined for the 180 days of being brick and mortar and or e-learning to constitute the required number of hours of instruction that we are by statute required to deliver. So when they say open up or begin, we can begin instruction in a different context of delivery and still qualify with instruction if our plan is approved. So you also have to keep in the back of the mind, I know nobody likes to think about this, but right now, and Mr. Kennedy asked me this question, state testing and assessments have not been waived. Does it mean it's going to be waived? Nobody knows. So, say you open in October, say you open in December. You're going to have to do 180 days of instruction or X amount of minutes per the Constitution. They give you flexibility in how you're going to present those minutes where you don't have to make them up. But the time and minutes to receive credits, etc., are an issue. And also remember, because you got to think the whole domino effect. As long as we push this calendar out, it means you delay graduation. How does that affect graduation? It affects seniors that may be going off to college, to military, etc. Now, I'm not saying it's not something we could do or should do. I'm just saying before we choose to delay the start of school, I need to come in with all those issues so we can have a real conversation and not a reactive conversation. I think, in my opinion, we're better off formulating a plan based on what we know today, based on hearing a large portion of the community saying, I want my child back in school, based on teachers saying, I want to go back to school to see kids, with safeguards, reduction of students in a classroom, coming up with all those kind of different methods, and see how the infection progresses. There very well could come a time where we have to put it all online. I don't know by delaying instruction is a good decision or an allowed decision.
Okay.
But the method of instruction could change due to the virus.
So your answer is no.
The answer is no, sir. I would prefer not to do that.
Then the other thing that I wanted to ask is, we've had a lot of discussion in terms of the problems that are attendant as a consequence of this virus. But I've not heard any discussion today about how we're going to help transition emotionally and mentally into this new way of education. And I'm really glad that Dr. Benz is still here. She's the she's the immediate past chair of the hospital that we have here, the Centerstone Behavioral Health Hospital. And I'm just trying to figure out, when will there be any focus on the harm that has already been done? None of us can predict the future, but just looking back at the devastation that has taken place just in our county, is there a provision in our plan, is there a provision in our policies that takes into account the emotional and mental toll that COVID-19 has had on the community? And how can we address that? What do we need to do about that?
Absolutely, and that is one of the requirements. It's also in the requirement that will be submitted to the Department of Education, and that is another reason why we really do need to try to bring students back in so that we can assess them. That is a requirement. We've got to academically assess what gaps they may have, but also assess their emotional status. What can we do to help them overcome some of those barriers and tragedies that have happened with their parents possibly losing income or their job, etc. So it's not an easy decision. We're sitting here saying, is it safer medically to keep people at bay in their homes? And you could easily see that we had a decline in cases when everything was shut down. But is that emotionally the best thing? Is that financially the best thing? So we're sitting here having to say, open up the schools and bring the kids in because we need to see them, we need to help them, we need to assess them. You don't get quite the same approach on a Zoom meeting. We've all participated in Teams or Zoom electronic meeting. They're better than nothing, but it's not the same as a teacher sitting across that child or a counselor sitting across that child and providing services and really having an in-depth conversation and seeing their emotion and having that privacy so you really are able to get all the information. So I do think right now, for their mental health, for their academic health, we need to try to open the schools up and see how we can perform and then reassess.
All right. Thank you very much. Thank you, Madam Chair.
Mr. Minor, I see your hand, but there's still 2 other people that signed up to speak, and I just want to be fair about it. Dr. Hopes?
Thank you, Madam Chair. Colleagues, I mean, I think from my perspective, where we are is we have a well-thought-out plan that keeps us in compliance with whatever we think this order is from a validity perspective. Mr. Minor's correct. The decision is ours, and we have that responsibility. But I think one of the opportunities that the situation presents us with is we have a community, and a significant portion of the community, that wants their children back in schools. We've heard from our county's chief health officer that we need a campaign. One of the most difficult, in my opinion, one of the most difficult fields in public health is education, public health education. That's why when I figured out what public health was, I went into epidemiology. And I can figure out the distribution and determinants of disease, and then I can give it to the health educators to do the hard work. But what we have is we've got at least half of our student population whose parents say, we want our kids back in school. That's a motivator. We have the technology to access in multiple modalities every family that has a child in our school district. Dr. Bensi has said it takes 14 days to create change. We basically have 2 incubation cycles left before August 10th, where if we use the leverage that I think we have with an effective education campaign that we create with our partners at the health department, we have the ability to tap into a large segment of Manatee's population. If you want your children to start school on the 10th, here is our plan. We need you to do your part, and we're going to help you to do it. And here are the things that you can do so that we can implement this plan. And I think that's where the board needs, that needs to be our position, that we have a well thought out plan, but in order for this plan to work, we need the cooperation of the entire community. And let's see if we can leverage that desire to get their children back into school so we can assess them, because I don't think there's a way for us to determine what the impact of this has been on development, on emotions, until we get these children in front of our classroom educators and our counselors. So I think, my preference and recommendation is we rally around this plan. We immediately move forward with a public health education campaign like no county in the state has seen. And we couple all of our resources, our technology, our ability to put it together, and our ability to reach these families in minutes and bombard them with a public health education campaign that will lead to us being able to implement our reopening plan. Thank you, Madam Chair.
Thank you. Vice Chair Kennedy.
Dr. Hopes, I completely concur. Dr. Bensi's exactly right. We could end this in 2 weeks if we all were on the same page, but unfortunately we're not. We have another government agency in town that is not willing to put a mandatory mask order in place, so that's a barrier. So I think that's a big part of this campaign, is getting one vote there that's willing to take a brave step. And but I also agree that there's so much passion on both sides of this issue, and even though personally I think public opinions in Manatee County are changing very rapidly, and I don't say that just because my own are. I say that because just our interactions with people and the 300 or so emails and public comments we've had just in the past few days speak to it. And I don't begrudge anyone for the passion that they bring to it. I've had people come at me, and I get it. You are defending, you want your child back in school. On the other hand, parents want to protect their child, and they think that means keeping them home and not keeping schools open. So, like Dr. Hopes, you hit the nail on the head. We all want the same thing. We just disagree on how to do it. And I think if we could organize a campaign and pull all of our other elected bodies together to convince, of this effort, this uniformity of effort, it gets us back to school. Like, reopening the economy and beating this virus are the same thing. So even though to me, from my outlook, some of these issues seem, the solutions seem maybe not easy but clear. But, you know, I fully support a public campaign with every entity in the county putting our resources behind it and our people behind it. I think that's a great idea. But I do have reservations, as you all know, with the plan. I just wanted to maybe this doesn't need to go in the plan because like our mask policy isn't in the plan that we have to submit to the state. But I do think we should make clear.
It will be.
It will be.
Oh, okay. But I do think we should also just make clear that one of our expectations is when to our students and to our employees is that as best you can maintain social distancing. You know, just all the stuff that we wash hands, keep distance, masks. So I don't know if we can put that into our code of conduct or into our employee manual, but I think that's just as important as the mask wearing.
We do have a COVID insert in the Code of Student
Right.
Conduct, so we'll make sure that all these expectations are listed in there as well.
Thank you. Thanks, Jane.
Reverend Golden. Oh, I'm so sorry. Mr. Minor was waiting his turn. Mr. Minor.
Thank
And then
you,
Reverend Golden.
Thank you, Madam Chair. I concur with Board Member Kennedy, Board Member Dr. Hopes. I think that the superintendent, should include in her letter to Tallahassee, the date. It asks for a date of completion. And I think that the idea is, basically the same, date, so we can go ahead and set graduation date. And we have that as part of it. It meets their request. And in their request, they said, okay, they have represented that even if we don't have the 180 days of education during the period from when we say we're going to start and when we're going to finish, that's okay. And if we say August 10th or 11th, we're starting out, and well, we find out we really can't start out, and it might be a month later. It still allows for graduations in May or whatever. And it's going to be the 5 on this board who determine, okay, on August 9th or 10th that, no, we got to put a halt to this, for at least 2 weeks or something like that. And if there's 3 of us who feel that way, that's the way it's going to be. But it won't impede the ability for there to be a graduation and a completion of schooling, for this coming school year. But it's kind of nice we call it pretended or what, that they can determine that. But we're going to hold it to them. And we say, okay, we're going to start, we're going to stop, and we don't have to say in the letter, we can maybe even stop it for 6 months, but we're still going to have a graduation and completion of the year, come May. We don't have to put that in the letter. But we have that authority. It's upon their representation that we don't have to have that 180 days. So, but I think that's the best way to go about it at this time, and we hope and pray and through our education that of the community that it gets better here and hopefully around the country and the world. Thank you.
Reverend Golden.
Thank you, Madam Chair. Madam Superintendent, the order also talks about reopening requirements subject to advice and orders of the Florida Department of Health, local departments of health. And I agree with Dr. Hopes that this is a time for us to try to work in a collaborative, cooperative manner. And so I would hope that there's an appetite from the Department of Health in keeping with what Dr. Hopes is recommending, that they would, in writing, indicate that they have reviewed the proposed plan and that it does meet the requirements, and that they advise us to, yes, this is about the best you can do right now. I say that because I would also like for us, at the time that we formally meet to approve your sending the plan, that we also embrace the partnership that we're talking about here today with the Department of Health, so that we can move forward in a formal way to this community. I think Mr. Kennedy said it, and I wasn't quite so sure if I heard you correctly, so I want to ask you, did you say that the restoring of the economy is the same as
Beating the virus.
beating the virus? You did this, you said the same thing? Okay, I disagree. We must beat this virus if the economy never gets restored. People, you can be hungry, you can have a whole lot of trouble, but once you're dead, you're done. We need to come together as a community and simply say our top priority is the health of the people. That's all. And that is paramount, that is first and foremost, that's what's guided us, that's what's directing us. And sooner or later, this country will recover from this economic decline. We recovered from the Great Depression, and we recovered from the Great Recession. But there are a lot of people that didn't recover from the Spanish flu, and a lot of people that didn't recover from the other ills that a lot of people died before they figured out how to deal with HIV. And that's going to happen now. I just don't believe it ought to be as many as it has been. So I don't want to, what's that catchphrase everybody uses now? Moral equivalency. I don't see the equivalency between economic recovery and trying to deal with the lethal impact of this virus. So I'd like to formally move that as a part of what we discuss when we get ready to vote, that we will join with the Department of Health in this county to make it absolutely clear that our commitment is doing everything we possibly can to keep everybody as healthy until a change comes, until a cure comes. And I thank you, Madam Chair.
Madam Chair, I know we're about to wrap up the meeting. I just want to ask one question. We are going to be voting on this plan on the 14th. Since we're all in here together, I would like to ask how you want to proceed on public comment. I know we had said we were rolling back to operate as we did before. We closed until August 1. It is a voting item, so I just would like, so everybody understands how you want to handle public, or how the board wants to handle public comment.
Written comments, written.
Okay, Dr. Hopes has written comments.
We
Vice
don't
Chair
need
Kennedy?
to bring people in here.
I don't think we should necessarily need to bring people in here, but I would like to see us, it's going to be a very watched and commented on meeting. If we could offer the 5 high schools that we did last time. I mean, I know the irony of having closed school board meetings while we're talking about reopening schools is a little, it doesn't strike me as fair. So at minimum, I think we should offer that public comment opportunity. I mean, we opened it up for 2 hours last time. We didn't even fill 40 minutes. And I think on, that's just my take. I think we should offer the high schools. Thanks.
I think people are getting really good at written comments.
Yeah, the total today was 46 public comments.
Yeah.
I counted them. We had 46. I actually think we're getting more, which I like it, Reverend Golden.
We had, I had 101 yesterday comments, and this morning I had more than 300.
I'm talking about official people that send in public comment, but you're right, we did get a lot of other emails. Yes.
And I guess the question for me is, unless we're gonna let 300 people speak for 10 seconds apiece, I agree that we ought to have written comments with respect to this, and we ought to cut them off so that we would have an opportunity to look at them and review them. I don't see why you should be penalized because you can't come or because you wrote, and somebody else is able to walk in here and say something. That I don't think that's quite fair. If it's important, you're right.
Yeah.
And that's all I'm suggesting, that we in this instance and for this issue, because of the voluminousness, did I say that right? The voluminousness,
Luminosity?
the voluminosity of the comments, that we will receive comments in writing.
Okay,
If we're gonna open schools, we need to minimize the exposure to our staff now.
Yeah, yeah.
Well, when schools are open, visitors will not be
But I'm saying,
admitted.
why expose our 5 schools to the public right now? Let's just take written comments.
okay, Mr. Minor, what's your point of view?
I agree, we ought to welcome written comments for this meeting, and I think that's the safest for everybody in the community.
Okay, so that's a majority of the board that's in favor of maintaining what we have been doing. I think it's been very effective, like Reverend Golden has said, I received probably in the hundreds of emails, and 46 official public comments. When people ask how do they reach out, I always give them that, because that gets to everybody reads them. So, is that the feedback that you needed?
Yes, ma'am.
Is there any other feedback that you need from this board in order to move forward on the 14th?
No, we will make the amendment to the mask statements, Mr. Kennedy.
Thank you.
Still allowing for families for medical or ESE?
Absolutely. In individual situations, and we will have a standard form process so that it's clearly documented, and we will take it into
Okay,
consideration.
I just want to make
Absolutely.
sure.
Yes.
All right, well then it is, friends, it is 6:22 PM. We have been going at this for over 5 hours, but I've learned a lot. It's been very informative, and I appreciate everyone being here, and we are,
Madam Chair?
yes.
Would it be an imposition for you to run the video where I said, not one penny more? Could
You want
we?
me to find it? You challenge me? I'll find it.
Before we adjourn, could,
You want to see it?
yeah, before
send
we.
it to you later.
No. I'm done.
And if there's no objection, I will adjourn.
Right.